Welcome to the Journal Club for this week. This is a clinical study with the title of Regenerative Endodontic Procedure with a minced pulp tissue graft in a mature permanent teeth. It was done by Kim et al. And it was published in the JOE. Despite the advances, autologous stem cell transplantation remains experimental in clinical regenerative endodontic due to its complexities and challenges in stem cells isolation, expansion, and to the requirement of a good manufacturing facilities and bank, and also for the high cost of those cells. So the aim of this study is to describe a clinical procedure for regenerative endodontic using a minced pulp graft, and to present a clinical follow-up of a patient treated with this modality. Also to explore a key factor that affects such a procedure. For their material and method, their inclusion criteria involve patients who aged between 19 and 35 and who had tooth required non-surgical root canal treatment or retreatment with a periodontal pocket depth that is less than 3 mm. Also, patient needed to extract their third molar without any need of odontosection, and that they did not have a caries cavity that involved the pulp. The procedure was held in two visits, and the patient then is scheduled for follow-up at 1, 2, 3, and 6 months, and then 12 months. In the re-evaluation, they had a clinical examination and radiograph, and they had 3D images before the procedure and every 6 months. So during the second appointment of the procedure, they did the extraction of the third molar. They make a notch with the use of a high-speed handpiece and a diamond burr, and then they split the crown with the use of spreader to be able to inoculate the pulp tissue. Then they minced this pulp tissue in a glass slab with the use of a blade, and after they evoke the bleeding with the use of a K-file, they place the minced pulp above the bleeding, and then they place bioceramic cement and then a GIC followed by backable composite. So they had 6 cases in a follow-up period that ranged between 19 to 42 months. Radiographically, all the teeth showed a favorable outcome. Among of these 6 cases, 2 showed no internal calcification and no recovery insensibility testing. 1 case has an internal calcification and no recovery insensibility testing, and another 2 cases also they had an internal calcification in the apical third with no recovery insensibility testing. 1 case that exhibits internal calcification within the apical third and regain of vitality with the use of a EPT and a cold test. So to consider all of these outcome and clinical variability between the cases, the size of apical foramen and the composition of the transplant pulp tissue were a key factor for such a procedure. So to conclude this study with the limitation, the use of a minced pulp graft and regeneration of mature permanent teeth in adult is considered an initial research suggestion that could be feasible and indicate more and further laboratory studies and randomized clinical trial with a large sample size to be able to implement this approach, with also standardize of the cases, the tooth type, and the size of the apical foramen. And thank you.